The longer you wait to get treatment, the harder it can be to get rid of it. I'm happy to say that in the thousands of women I've worked with, no matter how long it's taken her to get help, she does recover. It can just be a bit tougher to get rid of those symptoms. And we do have research saying that women are still depressed. Mommies are still depressed after a full year. About 25% of moms are still depressed. And just think, I can tell you from personal experience, it's not a pretty picture in that home. Every relationship within that family unit is being negatively affected. So we want to catch them as fast as possible. So, you know the symptoms of postpartum depression, I'm sure, but just know that if you have any stereotyped picture of what it looks like, get rid of it. I mean, sometimes that picture of the crying mom not functioning well in the bathrobe, you know, that kind of, sometimes it's exactly the way it looks, but not always. Sometimes anxiety is at the top of the symptom list. She's more anxious than anything else. Sometimes it's irritability or anger. So if she's thinking that postpartum depression means very, very sad, okay, and you ask her, which you never want to do you think you have postpartum depression? She might say no, but she might have a very severe case of postpartum depression. You never know what she thinks it is. So obviously you don't want to ask new moms to diagnose themselves because you don't know what their picture of postpartum depression is. One of my clients not too long ago said she was asked by a very well-meaning nurse in the OB's office, do you have postpartum depression? Do you think you have? And she said no. So she was sent on her merry way. She was thinking that a mom with postpartum depression had to have thoughts of hurting her child, and she didn't have those thoughts. So you want to ask very behavioral questions about sleeping and appetite and things like that we will get to in a very, very short time. Typically there will be sleep problems, usually insomnia. Sometimes it's the opposite. Sometimes it's hypersomnia. She can't get out of bed. She just wants to keep sleeping, especially if there's a bipolar disorder in there. But typically she has a difficult time sleeping at nighttime. Okay. If she's coming to your office literally needing to lean on somebody or looks like she's just not able to function well, certainly that's an indication. But the key here is you never want to assume that you can tell by looking. Sometimes you can, but you never want to assume you can. The questions have to be asked. I'm an expert witness in a number of cases, actually currently a number of cases as well. And through the last couple of decades, there have been some very, very tragic cases where the OB, again, meant well, but in his deposition, I would read or I would hear the stuff on the stand. Well, she didn't look depressed. Never count on knowing. She might be dressed perfectly with her makeup on, laughing at your jokes, you know? And she might be depressed as heck. We don't know what's going on in her head unless you elicit the information by asking the great questions, which many of you are doing already as I'm chatting with you, which is great. Okay. Appetite changes, usually poor appetite, especially if there's anxiety there because your tummy is in knots, very hard. And you'll hear the gist of what she's going to say to you is, I don't know what I'm going to feel like in any given moment. My emotions are on a roller coaster. This is very, very different from depression that happens at other times in our lives. When we think of depression at other times, it's sort of a flat, a flat feeling, blah, day in, day out, kind of the same. With postpartum depression, we're thinking because the endocrine system is involved the way it is, we are up and down and all over the place. So at 10 in the morning, she might feel anxious as anything. At noon, she might feel almost like herself, around 80% there. And at 3 p.m., for instance, she might feel depressed as anything. So she feels like she's losing her mind because she can never count on feeling any particular thing. It also makes it harder for practitioners to diagnose.